All right, good morning, everyone. Call to order the Yamhill County Board of Commissioners formal informal session for May 11th, 2023. It is 10:01 in the morning. And Commissioner Starrett, if you could please lead us in the flag salute. Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, item C is our calendar session. Anything to add to the calendar? Nope.
City County dinner in
Mhm.
Sheridan on Thursday, and this weekend is the Overland Expo. Commissioner Johnston, you going to join me in buying unnecessary farming implements from
No, I will not.
yesteryear?
And the Sheridan, I have AOC college, just so I won't make that one.
Oh, Thursday night.
County College, you're almost done, huh?
I got two more,
Okay.
and this is extra credit weekend.
Oh, you
for
better go.
next one.
Better show
Out
up.
at Tillamook, they're gonna give a tour, so. Shoot for a valedictorian.
All right. Okay. Item D is public comment. This time period is reserved for public comment on any topic other than an agenda item, quasi judicial land use matter, or a topic scheduled for a public hearing. I don't believe we received any written comment, but if there's anyone in the audience who would like to provide comment or online, please raise your virtual hand. Okay. Seeing none, we will move on to our department update, which is a presentation by our Health and Human Services Director, Dr. Manfred. Welcome, Lindsay. Good morning.
Morning.
Oh, I shared a lot of information with you all last week.
Yes.
So I will try to keep things high level. I know it gets a little hard to dive into all the things happening with HHS in a condensed time period. So I will just go over some high level things. And then of course, I'm happy to answer questions about things that I may not have touched on or provide more information about those things that I think. Some of the big overarching things I mentioned about this, so I won't go into detail, but we are working on implementing a new EHR system, which we anticipate will take probably at least 18 months to be able to do. We're working really closely with the CPO and the state around the redetermination to make sure that we have as many people who are eligible for be on the health plan. And of course, watch the legislative session very closely to see what impact we might see of our funding or so, all of those are just overarching pieces. I also have some positive news to share around our recruitment and retention. So we are now down to an overarching across the organization 9% vacancy rate. This is only a couple percentages higher than we typically run. So pre-COVID days, we were running generally between 6 and 7%. That's kind of what we anticipated. That's kind of how we operated, knowing that's likely to be where we're at based on turnover and things like that. So getting down much closer to that is doing, I think you mentioned, much better staff. We continue to struggle in some really specific areas in recruitment, largely our management. Many of the vacancies are on our management team, the supervisors, or managers. Some of the vacancies have been open for months to years. And the other area where some of our high specialized areas like mental health, where we continue to struggle with it. So we will keep working to understand how we can best get recruitment out and incentivize folks. But overall, good news on that side. Some other big things happening. Our mobile crisis expansion work continues. We received additional funds from the state as well as additional funds within our SEO contract that began in January 2023 to expand our mobile crisis. Just for a little bit of history and context, Gary, you probably know this, but our mobile crisis team is called our Community Outreach and Support, our COS team. And historically, it's been made up of 3 individuals. Those 3 individuals have provided the 24/7 coverage that we have been required as a community mental health program to provide. And you can imagine that's not full coverage of people working 24 hours a day, 7 days a week. Can't do that for people. And so we've done that through some different scheduling and then having them be on call for when there's a need that arises. Our work thus far has really been in 2 areas. One is hospital screening, so when someone's in the emergency department and needs to have an assessment to understand they are safely discharged. That has historically been the work of that team, as well as partnering with law enforcement call them if they have a call they're going on, they can dispatch to where there's belief that either at the time of them being dispatched from the 911 dispatch center, that there may be help involved, or once law enforcement gets there and requesting the situation, they can call that. We are now expanding from that team of 3 to a goal of a team of 12. The 12 people will be made up of 6 QMHPs, those are the qualified mental health professionals, so those are largely therapists and folks that can do those full assessments. The other 6 will be peers and other types of case management support. Our goal is to have 2-person teams be deployed when they are called for various reasons. So we'll have the partners buddy up with us.
Sorry about that. I hope I don't have to repeat everything. So we're really excited. Right now, we have 5 of the therapists or the QMHP positions filled, and we are recruiting for that 6th position and are currently recruiting for those other support positions as well. So that's really exciting. In terms of scope, we are working with a community partners group that includes law enforcement, includes folks from the cities. Who else does it include? Peer organizations such as Provoking Hope or Encompass Yamhill, and our 911 dispatch partners, where we're looking to find ways to make sure that we get the right people deployed at the right call. Because when we are increasing our capacity, we're also wanting to be able to deploy with our EMS partners, because right now it's really been exclusive to law enforcement, but we're really wanting to expand that out. The general community, once we're up and running, will be able to access mobile crisis through the 988 system. So we really want to continue to have community members themselves be directed either to our crisis line that's specific to Yamhill County or 988. That's answered by Lines for Life. And then Lines for Life really should be able to distinguish if mobile crisis supports are needed, and then they have sort of the back channel connections to us. We're also working to expand this work to include overdose work. So when there's an overdose, being able to deploy both on scene when appropriate, in the emergency department when appropriate, as well as do postvention and following up with people who may have been impacted by the overdose. That could be the person themselves, or it could be partners and family and friends and loved ones. It's a model that we use with suicide prevention, the postvention, and so we're trying to replicate that with this. So that's really exciting work, and we're happy that we're seeing those positions being filled as well. And the work with the partners that I mentioned has been really great. So that's exciting. I'm also working to relaunch our local alcohol and drug policy committee. Commissioner Sterrett, I know we were just exchanging some emails around there. It has been a group that's been a little stagnant, and so I'm working to get that up and running. Our DA, Brad Berry, is the current chair and has stated he is willing to continue in that role for the time being, and I'm grateful for that. So I'm hoping that over the course of this month, we'll be able to get that reinstated, and likely there may be some new membership, as there's some individuals that were previous members that are no longer either in our community or necessarily wanting to be part of this work. So more to come on that as we're launching, and certainly like any of those advisory committees, we'll make sure that you're on those invites as well. Yeah. We are working on the completion of the community health improvement plan through public health. So if you recall, we had the community health assessment that was completed. And we do that every 5 years. It's a robust assessment that includes both the qualitative data from our community as well as a really robust quantitative assessment. The team has been working really closely with our partners, the CCO and Providence, to complete this next part of the work, which is the Community Health Improvement Plan. And we will have a draft ready, hopefully by the end of the month. And I'm happy to share that with you. That will include the focus areas and some high-level strategies that we anticipate employing over the next 5 years. I know there's been interest in hearing an update on the fentanyl campaign, so I wanted to share where we're at with that. There has been the youth focus groups and sessions to really make sure that what we are doing and what that contractor is creating is something that's really resonating with the population we're hoping it will resonate with. And they have stated that by June 2nd, we should have the printed materials and all of the digital media that we're able to share out. And then by the end of June 30th, the platform of the website should be developed and ready to use as well. So I'm happy to share those materials when they come out so that you can have a look at them and share any of the thoughts that you might have once those are there. You also approved, I think it was maybe 3 weeks ago, the additional $16,000 that I had mentioned was coming that is really geared towards pushing out media. So it's really for the advertising costs. And so we're earmarking those funds to make sure that we have those ready to use when we have materials. And also using some of them, thinking about the things that we want to be pushing out now that already exist and just need to, bump up on social media through paid ads or things like that. So we anticipate June 2nd is when that should be there. Another public health update, we are working really closely with facilities and the selected architect to get the new space ready to go, and hope to have a process where we are soliciting bids soon for the actual renovation work that will need to happen to make sure that the space is usable for the team when we move over there. So those are my updates. Yeah, happy to answer any questions.
Thank you. So we have a couple resolutions today regarding fentanyl specifically because it's the National Awareness Week or Day. So really happy to hear the status of the fentanyl campaign, at least through public health and what we're trying to do, the goals we're trying to accomplish. The one thing I haven't been able to, we might have touched on this before, but I haven't really been able to drill down on numbers specifically, but the availability of Narcan and the kits and the training that goes along with that. Can you kind of talk about how that's changed maybe in the county over the past year? Have we increased? Where are we sending them? Who are we training?
Yeah,
that kind of thing.
Happy to share more. So, and it has dramatically increased in the last year. I would say this time last year, we were just trying to figure out how we could get our hands on more Narcan, both from a how do we pay for it perspective, as well as even just accessing it and finding a way to bring it, here so that we could distribute was really challenging. So we have been able to break through a lot of those barriers, both from a funding standpoint, as well as from just an access standpoint. And we do have a supply that we have at Public Health. On the Public Health website, organizations are able to go on to the website, fill out an online form and request doses of Narcan, and then it will be supplied to them. So that is going well. As of, I haven't had any updated numbers, I think, since February, but as of February, I think we've pushed out over 800 doses. A lot of that has been to partners, schools wanting them, organizations like Provoking Hope, who we are really relying on getting it into the hands of individuals who are most at risk for an overdose. And sometimes that's through the syringe exchange. That might just be through their connections and working through. So definitely distributing it to a lot of our partners, which is great. So like I said, at least over 800 doses, probably more now. And we've been advocating really strongly at the state level to make this more accessible, both to individuals, but also to organizations that are wanting to have a supply for their organizations, because there's been a lot of challenge, like I mentioned, in getting that. So hopefully we have seen some responsiveness, I will say, from the Oregon Health Authority around this, which has been really, really great to see.
Okay. I read an interesting article in one of our national county newspapers that talked about how some counties are actually setting up like vending machines with them because there seems to be a barrier, you know, if I went to a pharmacy and said, can I have a Narcan kit? They would take my information. And then there's an implication that I have a problem versus just wanting to be a first responder type of individual in the community. Is that something that, and the other part of that was that they placed them in the county courthouse or jail specifically because there's a higher rate of overdose post-release from incarceration. So is that something that is even feasible here or?
It's a great question. I don't know the sort of laws or rules well enough to know if something like that could happen. Certainly something I'm willing to look into in terms of sort of a more generic public facing distribution, just because it is a medication. And so there are some compliance pieces. I think the more available it is and the more discreetly people are able to access it, the better. So it's certainly a concept that I'm supportive of. I think that we would just need to be checking on some of those rules. Some of the ways that we have tried to eliminate that, the barrier you mentioned of individuals feeling apprehensive of connecting with a pharmacist or a healthcare provider or something, working closely with our peer support organizations. And then when we've also talked about, is there a way that when people are released from jail, they can have just a dose given to them, right? I mean, we have the supply, we're happy to do that. If we can just get the mechanisms figured out and at least offer it to anyone who's exiting. Certainly anyone who's in our programs, we're offering it to as well. So definitely individuals that are getting any sort of prescription medication through us. We're not prescribing things for pain or anything like that, but there are individuals who are getting medication assisted treatment for us. And even though the medication themselves is not something they can overdose on, obviously that individual is at higher risk because that is why they're coming to see us. So.
Yeah. Okay. Well, I appreciate the efforts. I spoke to a McMinnville police officer a couple weeks ago now that, that's pretty much what they're doing, right? They're responding and they're having to bring people back. So it's very sad. But I appreciate the effort to make that more readily available.
Yeah, absolutely.
Commissioners, any questions for Dr. Manfred?
Yes, Chair. Well, thank you for being here again. We appreciate it. There's the impending opening of the medical detox at Willamette Valley, and I think that's going to be a game changer. What systems are in place right now for you to be able to access that?
That's a great question. We don't have the referral pathway developed as of yet, but we do have the connection with the organization that is providing the service within the Willamette Valley Medical Center, and a commitment on both ends to make sure that both being able to access to when people are needing to get in is a really clearly defined pathway. In fact, we just met with hospital leadership, Jason Hennis, our behavioral health director, and our crisis manager, Bethany, and another nurse, Lindsay, who oversees our medical programs, all met with the hospital and had some conversation around, we need to make sure that this is a really smooth process, and that we all know exactly what we need to do to get someone access when they need access. And then on the flip side, making sure that anyone who is being discharged from the detox facility and is staying in Yamhill County, that there's really close connection and pathways that involve warm handoffs, that involve a lot of support and connection into the level of programming they need within the Health and Human Services service array, which is generally pretty intensive outpatient supports where folks are in our facilities daily and things like that. So we're working on both pathways and channels. And of course, it is a statewide asset, so it won't be exclusive to those people that are in Yamhill County. And so we'll have to see what it's like in terms of access. Certainly any access is going to be supportive of all of us, including anyone here.
Absolutely. So the on the agenda today, the Behavioral Health Workforce Initiative, is that going to help in terms of that's a separate question. The recruitment and the retention money, is that going to help maybe fill some of those positions?
It's hard to say. We're trying to get to the root cause of why some of these hard to fill positions are hard to fill and have been hard to fill for many years, or we see lots of turnover in when they are here. So potentially, I will say a number of our vacancies are outside of the behavioral health system and in our developmental disability system, and those funds are not able to be supported outside of behavioral health. So, but I do hope that it will. I think certainly the initiatives that we've put together around tuition reimbursement, around increased training, all of those things I've heard from staff have been really supportive, and they've really appreciated that. In addition to the House Bill 4004 bonuses and recruitment bonuses, we're hearing have had a positive impact as well.
Can you take some of that 16,000 that you got for pushing out the fentanyl information? Can you use that? I know I've been pushing the idea of swag nights because kids love stuff.
Yeah.
And sort of the incentive to get them to a thing, an event, a carnival type atmosphere where we, do what we do in terms of setting up various booths that we're telling a story here. This is someone who went through it. This is someone who recovered. This is someone who, a story of someone who didn't. I mean, the seriousness of it. And then the incentive of getting the kids there.
Yeah, the fun stuff, right? So we are in conversation with the Oregon Health Authority right now to determine if some of our funding streams can be used for purchasing those types of materials. We know that they can support the activities, the presenters, the speakers, the logistics of setting up an event. And so we are just doing that double check to make sure that it can purchase, whatever it might be, which could be things like swag. It could be, a raffle drawing where if you come and you go to all the booths, you get to put your name in the hat, and, there's something that teenagers love that you get a win. So we're making sure that that is something that those funds can be utilized for. And we already are having conversations. There's been ongoing conversations with schools that are interested in doing that.
But today is the day that OHA says, well, we don't need teachers and staff and healthcare professionals don't need to be vaccinated in order to do their job. So it's sort of like, I think public health has a long road ahead of it to try to restore some of the confidence in folks that are now being told some of the things they were told aren't necessarily true. So I know you've got your work cut out for you, and anything that we can do as a board to support truth around public health will be here for you. Okay.
Yes, so the fentanyl campaign, and as that advertising and those graphics start coming out and we have input or the public has input, can it be changed like on a fluid basis? If either it's not working on implementation and something needs to be changed, is that part of that initial package for them to change that? Is it an extra cost? Can it be done? Is it set in stone?
Yeah. It's a great question. So from a broad standpoint, I would say anything that we are doing within Health and Human Services, whether it's this or something else, we are always going through sort of a quality improvement process of understanding, okay, what did we get right? What did we not get right? How do we make it different? And then let's keep assessing. And it's just a constant cycle. So in the broad sense, yes, there's always room for changes, modifications. The contract itself for this specific body of work doesn't include anything after that that sort of launch date, but that doesn't mean we can't modify things, certainly on our end, and including the website, which we'll have full access to and be.
And we'll be seeing all that stuff before the end date of this contract to where we can possibly get some modifications done if we have input on it.
I'm happy to send them to you when we get them, if you want to provide feedback on them.
Yeah, my goal with that is that it's kind of what the Beaverton School District is doing now. Mind you, we're not a school district, but we can certainly partner with them and help them implement those types of things. But what Beaverton has done is made it required curriculum in their health classes. So all of those kids going through the high school health classes now get this educational campaign specifically regarding fentanyl and the One Pill Can Kill campaign, which is incredible. They did it in a reactionary way because they lost students in 2020 and 21, but that's the end goal, because these kids are like sponges. They're going to soak this up. I've seen unfortunately a lot of kind of complacency among adults, that they just don't see the problem, or they don't think it's as big of a problem. So that would be the ideal end goal, is how can we help these school districts partner and get it into the curriculum. So
yeah. And I will say the majority of our school districts are really great and engaged partners with
Mhm.
us and having these conversations. And what we have done with the funding that we have, that we are able to be flexible with, is really ask them, what are the pieces that you need? What's missing from your process now? And there are some districts that have said that we need funding to purchase this curriculum.
Yeah.
And so anytime we're able to say yes, we've been saying yes, then if this meets sort of the criteria, if this is allowable under our expenses that we can authorize, we're saying yes.
Is that,
Okay.
is that happening? Or is there,
Mhm.
there are school districts that are asking
Yes.
for support in that and we're able to provide
Yes.
that?
It is, absolutely.
That's good.
Yeah, it is really great.
Are they getting Narcan from public health or from the state school? Something?
From us.
Okay.
Mhm. Yeah, we are providing them. I believe all of our districts have them, and I think most of them have them in all buildings.
Great. Okay, any further questions for Dr. Manfred?
None.
No, thank you.
All right,
Thank
thank
For being
you.
here. Thank your
Hey.
team.
Appreciate
Should I
it.
stick around?
Before you go too far.
Yeah, I was gonna say there's some agenda items. I didn't know if you wanted me.
Right, but then there was also a question because you submitted an agenda item request for the ASA board appointment and that did not get on the agenda.
Oh, okay.
Is that something that you need action on today or can that wait till next
I think
week?
it can wait until next week.
Okay.
And should I just stay here? All right.
Okay, so that concludes our department updates. Item F is work session. There's nothing today. Nothing on our consent agenda, also nothing under old business. Which brings us to item I, which is other business. I1 is consideration of approval of amendment number 3 to an agreement between Yamhill County and Busy Bee Cleaning, Board Order 12-700, updating rates and scope of work retroactive to May 1st, 2023 with auto renewal. Do I have a motion to approve?
I have a question.
Okay.
Yeah. I'll make a motion, but I have discussion.
Okay, so Commissioner
moved.
Johnston moves approval, but we have questions.
Super simple question. So why is there redactions on it? It seems to be more location related and timing. It's very odd.
I think it's to protect the owner is what I'm guessing, or personal
But why?
information,
What's so?
addresses.
Yeah.
So the facilities that are being cleaned are part of programs where we have clients living. And so we redact that so that it's not public record.
Oh, I see what you're saying. Yeah,
Okay.
housing and recovery support locations.
Okay,
Got it. Okay.
cool. Thanks.
I thought you were talking about the owners of the company.
Oh, no, just odd. I've never seen anything come through that was redacted and I'm just like, it's curious.
All right, any further discussion? All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Motion passes. Item 2 is consideration of approval of agreement number 180161 between Yamhill County and the Oregon Health Authority for the Workforce Incentive Program in the not to exceed amount of $629,867 effective upon full execution through June 30th of 2024.
I'll move approval, and this was referenced in Dr. Manfred's
Yes.
presentation.
Okay, any questions?
None.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Motion passes. Let's see, item I3, consideration of approval of a request by Marion County to join Marion and Washington counties as an amicus in the federal lawsuit related to Judge Mossman's order limited admissions and treatment at the Oregon State Hospital. And this was introduced by Commissioner Starrett.
Thank you, Chair. This is an initiative, if you will, that has been spearheaded by Marion County Commissioner Danielle Bethel, and she brought it to the AOC HHS Steering Committee to talk broadly about getting support for us to sign on as a variety of counties to, as amici to a lawsuit regarding the aid and assist or the Judge Mossman issue in the civil rights litigation, which limits the amount of time. That's the short answer of the number of the duration of time that somebody sent to Oregon State Hospital can be there, and also basically not only shortening that, but the number of people, the people who are admitted to the hospital. So there's an awful lot to this, other than Marion County is really getting the brunt of this, in that when people are released from the hospital, they're in their community, and the resources to address those, that not only the public safety, but the ongoing treatment and the recovery for people being released from the hospital. So she asked us to sign on, and this would not be to sign on to the lawsuit. This would be to sign on as an amicus to the lawsuit. And so basically it's Marion County and Washington County that have taken the lead on this. Christian, if you wanted to add anything, I could go into the specifics, but just maybe information which would be good for us to know is while we perhaps maybe just have one aid and assist release that was high profile in this community and had public health safety concerns. If you look at the number of people that are in there from Yamhill County, we have 6, we have 4 felonies, 1 misdemeanant, and then 1 that is not listed or labeled. So at this particular point in time, there are 6 individuals that could be released into our community. And again, we know what happens when we try to address the shortfall of resources, and also, quite frankly, the public safety concerns. So I'll go into more detail about what the Mossman order wound up netting us as counties, unless you're all familiar with that. But Christian, if you wanted to, I know that you've had conversations with their county council and their DA as well.
Yeah, there are a number of cases in the system. Neither Marion County or Washington County or any other counties for that matter are actual parties to the litigation, but they have filed several amicus briefs to provide additional information to the court about the different impacts of the orders. And I think there is some expectation that some other orders could be coming in the near future. And that's kind of, I think, where their focus is now in terms of gathering some additional support to help explain to the court what the broader impacts of these orders are on counties. And so if the board approves this, then I'll reach back out to Jane Veto, County Council in Marion County, and work with her to make sure that we can get file the right paperwork with the federal court to make sure that we're able to join on in any other future amicus briefs that Marion County or Washington County or other interested counties prepare and file with the court.
The other thing I wanted to add is that I guess the bottom line is that oftentimes these are not patients who are being released are not in for trespassing. These are in many cases violent felonies, and it's concerning. So they're person-to-person crimes, and then we would be on the hook for dealing with that in our community, and we just don't have the resources as it stands. So we're just hoping that this greater collective action will bring some attention to what it means to counties.
Yeah. It's certainly a complicated issue, and what we and other counties are seeing are releases that are being driven by the order of patients who may not yet be fully rehabilitated and able to then aid and assist in their own defense, which is why they were sent for treatment to begin with. And then there are issues with transportation back and forth to the responsible counties, and then the DAs are left with difficult decisions about whether or not they're able to, or how they want to even proceed with the charges that may have been filed against these individuals. So it's very complicated. I've talked with Director Manfred and the sheriff, and being a smaller county, we don't have the numbers that some of the larger counties do, but we do have a few, and we certainly could face any one of these issues at any point in time in the future. So I think we're well situated to participate in this if the board chooses to do that.
So the statement that we might be signing on to, is that something that is already drafted that we're joining others in, or is it specific to Yamaha County's needs?
I would expect the former, that it would be something that would be drafted. I'm not sure who would be drafting that. I think what they were also interested in is if there were specific experiences and issues that were being felt by these counties, that would be good information to include. So if we do happen to have a situation that can be included with some more specific Yamhill County information, I think that's certainly a good idea. Otherwise, we would simply be signing on to the briefs that have been prepared and sort of adding our name to the list of concerned counties.
Okay. Well, I think it's absolutely imperative that we do. I think, the concern on the sidewalk, so to speak, is that these individuals are clearly not ready to be released. They have not met the threshold of reaching treatment, levels that are appropriate to the crimes that they committed. The individual that Commissioner Sterrett was referring to was released into our community and has gone on to, threaten, for lack of a better term, one of the victims of his original crime. So it's a considerable problem. Polk County is having the same issues with an individual who murdered 2 people. So this isn't something that is just like you said, property crimes or trespassing. This is very, very serious. So I would support joining Marion County in this effort. And I know that Polk County as well is considering signing on too. So we just need a motion to. Okay, that should be sufficient.
I'll move approval of item I3.
Any further discussion?
None.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign.
Excuse me, clarification. Christian, so you will be reaching out to County Council in Marion County and looking for next steps?
Yeah, and I
trying to
think
reach
they
out to her
said
today.
the court date was yesterday or maybe the day before, but that's okay. We can still sign on, but
I didn't hear from her that they were preparing another brief that
Okay.
had a pending deadline, but I'll certainly follow up with her today.
So you'll be contacting them and we won't have to do anything at this point.
No,
Okay,
yeah, I'll reach out to her and hopefully have a chance to chat with her about next steps today.
okay, because she was very clear and the DA gave us some backstory. Well, Marion County's got the heavy lifting there, but it was
Yeah.
really good to hear from them. So thank you for doing that.
Yeah, sure.
okay. So just to clarify, the motion passed unanimously and we will move forward with that. Let's see, item I4 is consideration of approval of resolution 23-05-11-1, supporting a recovery-oriented system of care and responding to the addiction, mental health, and homelessness crises. This is something that I added, commissioners. This is I would call them a set of resolutions by counties outside of the Portland metro area. Clackamas County passed a resolution a couple weeks ago that is very similar to this one. And they did so in response to this pressure that we feel as counties to solve the homelessness crisis, right? We all know it's a problem, but we also know that we see correlations between that and addiction, substance abuse, physical health constraints, all of the above, and they're all related. And so this resolution is one that I was asked to consider by Clackamas County. I've made it a bit more specific to our county, but Marion County will be considering this, I believe, next week, and then Polk County is considering it as well. And it's really just a confirmation of our commitment to not only looking at the homelessness crisis and doing what we can, but also making sure that we understand and folks understand that our work is focused on the wraparound services as well, which are critical to making housing solutions successful. If you are dealing with individuals who are suffering from addiction, and, the solution is to simply place them into housing with no wraparound support, that's not going to be very successful. And we've seen that. So this resolution is really sort of to set the tone of our efforts and reconfirm the efforts that we have done with regard to housing and with regard to treatment services. And so if you would like me to read the resolution, I'm certainly willing to do that. No? Okay. So I will move approval of the resolution in the matter of a resolution supporting a recovery-oriented system of care in responding to the addiction, mental health, and homelessness crisis. Resolution 23-0511-1. Is there further discussion?
Yes, Chair. Well, first of all, I want to thank you, and I want to thank Clackamas County and Marion County for being at the forefront of this. One of the things we've heard over the last few years is the housing first model, and that was going to be the panacea for the people that are on the street. And we know, and anybody who has loved ones who are suffering from addiction and they are homeless, know that you can't just put a homeless, addicted person in an apartment and expect there to be any success there. They just can't do it. You're basically giving them the opportunity to kill themselves. I think this really speaks to the sanity of trying to deal with addiction, which is a lifelong disease, and to trying to sort of strike at the root. So thank you for this, for acknowledging that it's just an impossible thing to try to house people who are still suffering from addiction. I think this is very common sense.
The other component of this resolution is really to address the growing concern over public spaces. We've seen that specifically as an example in McMinnville, where we now have a community group of over 1,000 people who have come together to try and solve and pressure the city council to solve this problem, because we are seeing RVs, campers, needles, all sorts of things in public spaces where kids have soccer games, and the two are not compatible. So it's also to recognize that we really expect there to be a level of recognition and work and effort to solve some of those issues so that we do have safe and clean public spaces.
Well, this is not something that's just in bigger cities like McMinnville and Newburgh, but I met with the mayor of Lafayette yesterday, Mayor Malcolmson, and they have issues in Lafayette dealing with homelessness and folks that are sleeping in bus shelters and RVs and campers and things. So it's something that's pretty much ubiquitous. And business owners in McMinnville telling us they have to hire extra staff just so that when their staff take the garbage out, they're not assaulted by homeless people on their property. It's gotten to be where it's all encompassing, and it's something's got to change.
Great, thank you. Commissioner Johnston, any questions?
No.
Okay, I think I moved approval. All those in favor of resolution 23-0511-1 signify by saying aye.
Aye.
Aye. All opposed, same sign. Sorry. Okay, motion passes. Thank you. Okay, commissioners, I have an add-on for today. It's a resolution regarding fentanyl specifically. And I can send a copy of the draft to Carolina as well. So as we've been discussing, this is the 9th, May 9th was National Fentanyl Awareness Day. And there's been an effort in the community to recognize this this day and raise awareness. With regard to our youth, I'm really encouraged to see the effort and the progress forward that public health is making to reach our kids. This is just something that tears me up inside, frankly, when I think about children not knowing what they're ingesting and taking one pill and losing their life over it. It's just absolutely devastating. So I will go ahead and read the resolution since I just added it on. This is the matter of a resolution recognizing May 9th, 2023 as National Fentanyl Awareness Day and recognizing Yamhill County's commitment to educating our residents and youth on the dangers of fentanyl. Whereas in 2022, the Drug Enforcement Agency DEA recognized the first National Fentanyl Awareness Day and opportunity to educate the community about the dangers of illicit fentanyl. And whereas May 9th is being recognized as the 2023 National Fentanyl Awareness Day. And whereas drug traffickers mass produce fake and counterfeit pills in an effort to falsely market them as legitimate prescription pills and or candy, resulting in deceptions and threats to communities throughout the nation and locally. And whereas the DEA has observed a dramatic rise in the number of counterfeit pills containing at least 2 milligrams of fentanyl, which is considered a deadly dose. And whereas fake or counterfeit pills have been identified in all 50 states and the District of Columbia. These fake and counterfeit pills are easily accessible and often sold on social media and e-commerce platforms, making them available to teens and youth. Fentanyl is involved in more youth deaths than all other drug-related deaths combined. And whereas over the last 20 years, drug-induced deaths among those 15 to 35 years of age have increased sixfold, largely driven by the increase in fentanyl drugs. Fentanyl-involved deaths are the fastest growing among 14 to 23-year-olds. And whereas in 2020, drug overdose and poisoning deaths for persons 14 to 18 years of age grew by 169%, more than 3 times as fast as the national rate and faster than any other 5-year age group. And whereas in 2021, Oregon saw 11 fentanyl-related fatal overdoses in ages 0 to 17 and 53 in ages 18 to 24. And whereas the state of Oregon, through the Oregon Health Authority, established a dashboard monitoring overdoses in the state and each county, working in conjunction with the Oregon-Idaho High Intensity Drug Trafficking Area, or HIDTA program. And whereas fentanyl is now the second leading cause of unintentional overdose in Oregon after methamphetamine. And whereas Yamaha County Public Health is committed to addressing the dangers of fentanyl specific to youth and is developing an educational platform to share with municipalities, school districts, and educational organizations to share collateral specific to campaigns aimed at youth. Now, therefore, be it resolved that the Yamaha County Board of Commissioners recommends as follows. The Yamaha County Board of Commissioners hereby adopts this resolution to recognize May 9th, 2023 as National Fentanyl Awareness Day and supports the work in our county happening at all levels to protect the well-being of our residents and youth. Commissioners, I will move approval of the resolution. Is there further discussion?
None.
None.
Okay. All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Great, thank you.
Thank you for bringing this.
Absolutely. Okay. Okay, I don't believe we have any other business add-ons. So that leaves public hearings. We have nothing today. And announcements. Anyone have
Uh,
announcements?
Just meeting with Lafayette Mayor Hillary Malcolmson yesterday and talking a little bit about the concerns and some of the things going on in Lafayette. Very encouraged by the new mayor's willingness to make connections with various jurisdictions within the county. And it seems she's really got her heart for her city now, and looking forward to more communication there. We have the Overland Expo at the fairgrounds, which draws people from really all over the country to come. And too bad you won't be there, Commissioner Johnston, but I will be. And anyway, it's a wonderful revenue generator, and it's also a great economic development generator for our county. And then you can also find cool stuff.
It's super cool.
And just wanted to say we have a monthly suicide prevention group that is growing. It's statewide, and we have our suicide prevention person, Kelsey, who is there. There's a new program I'm going to be talking to you about called Handle with Care that addresses how law enforcement can work with the schools on some of our more troubled children anonymously. And I think that could be a game changer. So we'll be talking more about that. But yeah, lots of really good work in that department.
Great. Any announcements?
Went to SWAC meeting, the Solid Waste Advisory Committee meeting last night, and just there's gonna be some increases coming for us for ecology and for waste management.
It's never a decrease.
Nope.
No.
And it's the same stuff that everybody else is running into. I mean, it's having to pay more for truck drivers to pick up garbage. It's cost of fuel. It's equipment. I mean, they're out 3 years on getting garbage trucks. So it's just a multitude of issues. So I think Recology was a little over 9% increase, and I think waste management's gonna be 11% plus. On waste management's end, because Riverbend's closed down, it's costing more obviously to go haul garbage farther away. So Coffin Butte, I guess, is where ours goes now. They're gonna increase their costs. They got about a 15-year capacity out there, which in landfill years is not very long. So, I mean, the next closest ones, there's one in Washington and then the other one be Arlington. So it's just gonna keep getting more and more expensive. They did bring up that the contract renewal is it's a 9 or 10-year renewal for waste management. They're gonna review it for 30 days before next month's meeting, or maybe their meeting's in July, but they'd like county council to review it because it's a 30-year-old contract, just to make sure there's no updates that need to be done to it. So you'll be seeing that coming down the pipe.
Yeah, we've looked at that periodically over the years.
Okay,
So happy to do that.
that's all I got.
Thank you.
So we obviously had a special emergency session yesterday morning at 9 o'clock regarding measure 36227, the formation of the proposed McMinnville new fire district. I would encourage everyone, if they have questions, to listen to that meeting. It's posted on our website under our meeting lists with the audio from the meeting. And let's see, in our AOC meetings on Monday, trying to think of what day, Monday. It was reported to commissioners across the state that, there's some chaos. I don't know what the term is, chaos in Salem with the legislative session. Lots of unknowns, and that they expect the Oregon Economic Department to come out on the 17th, which is next week, with the quarterly report and the expectations for the economic environment in Oregon, and that they are fully expecting an announcement of a recession or recessionary period. And so that obviously impacts what we do, as well as the stalling of bills and legislation in Salem and how it impacts our county. So we're watching that very closely. I don't have anything else other than Happy Mother's Day to all the mothers out there
Mother's Day.
this weekend. Anything else for the good of the order? Okay, I will adjourn the formal session for May 11th, 2023. It is 10:54.